Hi, my name's Kirby. My group members Bronte, Emmy and Kerry, who unfortunately can't be here right now, looked at mental health. Our interview was done at Banyule Community Health, which we may refer to in these videos as BCH, located on Alamein Road in West Heidelberg. We spoke to social worker Lara Jackson. Lara is the dual diagnosis project leader in the drug, alcohol and mental health sector at Banyule Community Health. Dual diagnosis is the term used to describe patients with both severe mental illness and problematic drug and/or alcohol use. Lara has been working at Banyule Community Health for 8 years and has been in the drug, alcohol and mental health sector for 4 years. In these videos, we will be discussing our findings from the interview we had with Lara, including the history, funding, governance, structure, policies and services at BCH. Banyule Community Health was established 40 years ago in 1975 when a group of bold and visionary community members recognised the want and the need for adequate services for local people. By the 1990s, the facility, which was located in the administration block of the 1956 Melbourne Olympic Games Village, quickly became difficult to maintain in order to meet the demands of the community and the growth of the agency. The place was falling apart, along with inadequate space for the various health professionals now working there, led to a call for strong leadership from the board. The announcement of funding for the BCH redevelopment came in May 2004, and the staff as well as community members were very thrilled to see the recognition it was given and the resources that it deserved. In 2007, the new and improved BCH opened its doors. In 2014, BCH was awarded with 2 of the largest awards in primary health, the Premier's Primary Health Service of the Year and the General Practice of the Year. These awards are built on strong commitment to innovation, quality and excellence. Banyule Community Health provide a range of services in which Emmy will discuss with you all later. The Henderson Poverty Inquiry led to the funding of the community health programs, a response to the impact of generational poverty and disadvantage. Banyule Community Health has previously been known as West Heidelberg Community Health and Diamond Valley Community Health, but has always and continually adapted to the local needs of the community and expanded its reach over time.
Banyule Community Health is a standalone, not-for-profit organisation. They are governed by a board of directors who aim to provide and improve health outcomes. Banyule Community Health is funded in different ways. They are allocated government grants, 80.3%, patient fees, 14.3%, donations, 0.3%, and the assistance from a wide range of volunteers. When discussing with Lara, it was evident that there were some challenges associated with their government funding. These limitations included accountability for your work, your patients, and your delivery of care, specific targets. The board of directors set a specific goal. If this goal is set too high, it may damage and cause greater impact on the quality of care. And waiting lists. The particular targets may generate waiting lists. In turn, much-needed patients and at-risk patients may not gain access to the required help necessary. Overall, the quality of care may be impacted negatively due to the targets and goals if they are not assessed properly. They can lead to quantity over quality. There are numerous funding agencies which assist in Lara's particular field and Banyule Community Health overall. Home and Community Care, the National Disability Insurance Scheme, Alcohol and Other Drugs, and Northwest Alcohol and Other Drug Services. They all provide a safe space, knowledge and funding. The main goals Lara and her team would like to see include meeting client targets without impacting the quality of care, no waiting lists, this may mean connecting with other health facilities, and viewed by the public as an approachable and helpful service in all areas.
The Business Dictionary defines governance as an establishment of policies and continuous monitoring of their proper implementation, by the members of the governing body of an organisation. It includes the mechanisms required to balance the powers of the members and their primary duty of enhancing the prosperity and viability of the organisation. Banyule Community Health states that strong governance supports our corporate, clinical and environmental responsibilities to ensure stability. This is achieved with their board of directors and their consumer reference group. The board of directors has responsibility of oversight and direction of processes, systems and standards involved in directing, controlling and adding value to the organisation. The board sets the strategic direction in line with community needs and oversees compliance and risk associated with services. Ensuring service is solvent, safe and accountable are crucial elements of good governance and good stewardship, as well as a focus on future positioning for the services. The Consumer Reference Group is a volunteer program run by the members of the community. They assist BCH in establishing the needs and goals of the West Heidelberg community by working with service users and the board of directors. Together they have established a strategic plan with the purpose of improving the health and well-being of their community. This can be broken down into 5 strategic goals. These include community experiences. Service users are empowered, welcomed and supported by services while being respected and listened to. Service and programs, providing high standards of accessible programs and services to provide that to people that need them the most. Partnerships, aligning with partners to jointly develop solutions to complex issues. Culture, investing in staff and volunteers who are valued, resourced and developed to meet our purpose. And lastly, of course, governance. In order to achieve these goals, Banyule Community Health Centre has its own explicit values. These include respect, honouring diversity and equity, excellence, going above and beyond, courage, advocate and innovate, and dignity, the right to be heard and valued.
An organisational chart is a specific diagram that outlines a relationship and ranking system of positions within an organisation. At Banyule Community Health, there are many roles and formal titles from the top down. Relationships are based around what is needed by the community and what work positively makes a difference. Some programs which have been introduced as a result of need include drug and alcohol help groups, counselling and emergency relief. Depending on what the community needs impacts what workers are required and the level of qualification necessary. There are different levels which influence the structure of Banyule Community Health. As mentioned previously, Lara is a dual diagnosis project coordinator. She sits nicely in the middle tier. She's still required to report above to the board and yet also has workers below and next to her to assist her. The other members that make up Banyule Community Health include the Board of Directors, the CEO, Client Services, the Executive Management Team, volunteer staff, intake workers, project and team leaders, pro bono professionals, and administrative workers. All these workers have a role within Banyule Community Health and provide assistance to the community.
The policies and procedures of BCH are shaped by their core values, being respect, excellence, courage and dignity. Respect, the BCH honour diversity and equity. Excellence, they go above and beyond. Courage, they advocate and they innovate. And dignity, they have the right to be heard and the right to be valued. It is important to recognise these core values, as Lara shared with us exactly how important they are. Their values are an integral part of who they are and what they do. These values are expressed through every single thing that they do. Working in the mental health field of Banyule Community Health, there are a range of policies in which they must adhere to, such as the Mental Health Act 2014, the Charter of Human Rights and Responsibilities Act 2006, and Australian Association of Social Workers Code of Ethics 2006. I apologise that I can't say association properly. The Mental Health Act 2014 places people with a mental illness at the centre of decision making about their treatment and care, as well as establishing strong safety measures and oversights to protect the rights, dignity and autonomy of people with mental illness. The Charter of Human Rights and Responsibilities Act 2006 sets out the basic rights, freedoms and responsibilities of all people in Victoria. It is about the relationship between the government and the people it serves. AASW Code of Ethics 2006 is the core document which informs and guides the ethical practice of social workers. An important policy that Banyule Community Health follows is the confidentiality and privacy policy. This policy is in place to ensure the privacy of client information and secures the rights of their clients, allowing a safe and trusting place for them.
Banyule Community Health prides itself on providing quality services that are accessible. Many of their programs have developed models of service delivery that provide immediate assessment and service. Being a community health centre, Banyule Community Health provides a wide range of services ranging from allied health, legal services, to community programs and activities, adult training facilities and social welfare programs. The Allied Health Department covers services from Aboriginal health services, clinical and community nursing, dentistry, dietetics, physiotherapy, speech pathology, occupational therapy and a medical team. They also provide a range of community-based groups that provide support to marginalised or isolated groups and individuals and those experiencing hardship in order to provide support and the social network in a welcoming and safe environment. These services include better health self-management, breast cancer support, carer support, dual diagnoses, family violence, men's shed, mum's wellbeing, Somali men and women's planned activity groups, and women of West Heidelberg. Such programs give the community and its residents the opportunity to have a sense of belonging. They also provide a great and vast variety of social work and welfare programs and services. These include counselling, including drug and alcohol and financial, family rights education, gamblers help, emergency relief, psychology, family violence, youth foundations, and mental health services. So therefore it is clear that Banyule Community Health Service users are diverse, and this is celebrated and encouraged with their range of services, programs and groups. They have developed appropriate services in the area that is highly cluttered with community housing and people from a low socioeconomic status. However, being a not-for-profit community service, BCH does lack some services. Lara stressed the needs for a 24-hour or an after-hour emergency relief team that would focus on service users with acute problems and complications that could be managed by a social worker. At the moment, such incidences are dealt with by the emergency response team at the Austin Hospital. This is seen as an inappropriate use of services as it costs the tax system $500 for each admission. So although they have grown and developed services that are needed in the West Heidelberg area over the 40 years they have been operating, there is still and always will be a need for innovation and diverse services.